Your eyes are the only place on your body where a doctor can see your blood vessels and nerve tissue without cutting you open. The back of your eye contains the only externally visible portion of your central nervous system. It is a direct window into the health of your brain, your heart, your liver, and your blood. And the warning signs it displays are not hidden. They are sitting right there on the surface, sometimes for months or years before the condition they represent becomes dangerous. Grab a mirror or open your front-facing camera right now, because every sign we are about to cover is something you can check on yourself before this video ends. Sign number 1. Yellowish bumps on or around your eyelids. Look at the skin of your upper and lower eyelids, particularly near the inner corners. If you see small, flat, yellowish patches sitting just beneath the surface, you are looking at xanthelasma. Most people assume these are age spots. They are not. Those deposits are pockets of cholesterol that have physically accumulated under your skin. A study published in the British Medical Journal tracked over 12,000 people and found that individuals with xanthelasma had a significantly increased risk of heart attack and cardiovascular death, even when their standard cholesterol panel came back normal. That is the part most people miss. You can have textbook numbers on a blood test and still develop these because the deposits reflect cumulative lipid exposure over time, not a single snapshot. If you see them, do not cover them with concealer. Mention them to your doctor and ask for a comprehensive lipid panel that goes beyond the basics. Your eyelids are flagging what your blood test might be missing. Sign number 2. A gray or white ring around your iris. Look at the outer edge of your colored iris where it meets the white. If you see a faint arc or complete ring of gray or white discoloration circling like a thin halo, this is called arcus senilis. In older adults, it is common and often harmless. But if you are under 45 and you can see this ring forming, that changes everything. In younger individuals, this is a clinical warning sign for familial hyperlipidemia, a genetic condition where your body produces dangerously high cholesterol regardless of diet or exercise. The ring forms because lipid particles are physically depositing in the periphery of your cornea where the nutrient diffusion gradient is weakest. It is cholesterol sediment settling at the shoreline. Research published in the journal Atherosclerosis confirmed that corneal arcus in adults under 50 was associated with markedly elevated cardiovascular risk. If you are young and you see this ring, do not assume it is a normal color variation. It is your cornea showing you what is circulating in your blood. Sign number 3. The inside of your lower eyelid is pale. Use your finger to gently pull down your lower eyelid and look at the tissue inside. In a healthy person, this should be a vibrant pink or light red. That color comes from the dense network of tiny blood vessels filled with oxygenated hemoglobin. If that tissue looks washed out or closer to white than pink, you may be looking at anemia. Your blood is not carrying enough red blood cells or hemoglobin to deliver adequate oxygen to your tissues. Doctors have used this exact check as a rapid screening tool for centuries. A study in PLOS One confirmed that this conjunctival pallor is one of the most reliable bedside indicators of moderate to severe anemia. If both lower eyelids look pale and you have also been experiencing unusual fatigue, shortness of breath during mild effort, or dizziness when standing, those symptoms are likely connected. Your eyelids are showing you what your red blood cells are failing to deliver. Sign number 4. A persistent eye twitch. Brief eyelid flutters that last a few seconds are normal. But if your eye has been twitching for days or weeks, your body is escalating the message. The most common driver of prolonged eye twitching is magnesium deficiency. Magnesium is essential for muscle relaxation, and without adequate levels, muscles get stuck in a contractile loop. Research in the journal Nutrients confirmed that subclinical magnesium deficiency affects an estimated half of adults in Western populations because modern processed diets have stripped this mineral from the food supply. The eyelid is usually the first muscle affected because it is so thin that even a minor deficit disrupts its function before reaching larger muscles. However, if the twitching starts spreading beyond the eyelid to your cheek or the corner of your mouth, that is a different signal entirely. Hemifacial spasm, caused by a blood vessel compressing your facial nerve, can start as what looks like an innocent twitch before progressing. If yours has persisted for weeks despite better sleep and reduced caffeine, mention it specifically rather than continuing to dismiss it as stress. Sign number 5. Chronically red eyes that will not clear. Everyone gets occasional red eyes from late nights or dry air, but if you see a persistent web of dilated blood vessels that has been there for weeks or redness that keeps returning to the same spot, your eye may be reflecting a systemic vascular problem. The blood vessels in your sclera are among the smallest and most fragile in your body. They are often the first to show damage from conditions affecting the entire vascular system. Chronic high blood pressure can cause these vessels to become permanently dilated. Uncontrolled blood sugar can damage the walls and cause microaneurysms. A study in the journal Ophthalmology found that retinal blood vessel analysis detected through standard eye exams could predict cardiovascular events with reliability rivaling traditional risk models. If your eyes are chronically red and drops are not fixing it, the problem may not be in your eye at all. It may be in your blood. Sign number 6. Your eyes are protruding more than usual. This change often develops so gradually that the person experiencing it does not notice, but the people around them do. If someone has mentioned that your eyes look wider or more prominent, do not dismiss it. Bulging eyes are one of the hallmark signs of Graves' disease, an autoimmune condition where antibodies attack not only the thyroid but the tissues behind the eyeball, triggering inflammation that physically pushes it forward in the socket. Research in the New England Journal of Medicine found that up to half of Graves' disease patients develop eye involvement, and in many cases, the eye changes appeared before any other thyroid symptom. You might not feel your heart racing yet, but your eyes are already being displaced by the immune response behind them. If this is accompanied by dryness, difficulty closing your lids fully, or pressure behind the eyes, a thyroid function test is warranted. Sign number 7. Your pupils are suddenly different sizes. Look at both pupils right now. They should be close to identical. Mild asymmetry of a millimeter or less exists naturally in about 20% of people and is harmless. But if one pupil is noticeably larger than the other, especially as a new development, this can indicate a neurological emergency. Your pupils are controlled by two opposing muscle systems regulated by your autonomic nervous system. When they stop responding symmetrically, something is interfering with the neural pathway on one side. On the milder end, certain medications or prior eye trauma can explain it. On the severe end, a significantly dilated pupil that does not react to light can signal increased pressure inside the skull from a bleed, a tumor, or an aneurysm compressing the nerve that controls constriction. Emergency physicians check pupil symmetry immediately in trauma patients because it is one of the fastest indicators of whether the brain is in danger. If you notice a sudden change in pupil size accompanied by a severe headache, visual disturbances, or eyelid drooping on the same side, that is not a sign to monitor at home. Most of the time, unequal pupils turn out to be benign, but the serious causes are severe enough that this one is never worth guessing about. Your eyes are running a continuous health broadcast every day. Cholesterol in the deposits on your lids. Blood health in the color of your inner lid. Vascular damage in the redness of your sclera. Immune dysfunction in the position of your eyeball. Neurological status in the symmetry of your pupils. You look at your eyes every single morning. The question is whether you are actually seeing what they are showing you. Go check right now. Run through every sign and tell me in the comments which one you found or which one made you immediately think of someone you know. And if sign 7 unsettled you, send this to someone you care about. The person who needs it most probably has no idea their eyes have been trying to warn them.